CBT, cognitive behavioral therapy, has become the most popular form of therapy offered by most therapists. But is it really the most effective? Let's see what some research papers say. Hi, welcome to my channel on mental and physical health. My name is Gabriel Patridge. I'm a consultant in psychology and a physician. And in this video, I will talk about the effectiveness of two of the many types of therapies that are being offered for treatment: cognitive behavioral therapy, CBT, and psychodynamic therapy. I want to be clear that I'm not saying which one is better, as I do believe that the different types of therapies that are being offered can work for anyone. And I made a video on how to choose a therapist, explaining the different types of therapies to choose from that I linked below. But I do want to debunk the idea that CBT is the most effective form of therapy that is being offered. Insurance companies that prefer to pay providers as little as possible have created this prevalent myth that short-term evidence-based therapies like CBT or DBT will cure depression in 5-20 therapy sessions, or that EMDR will resolve all trauma symptoms in 6-12 therapy sessions. So let's start by comparing the approach that CBT and psychodynamic have. CBT is based on the idea that our thoughts, emotions, and behaviors are interconnected. It focuses on identifying and changing distorted or unhelpful thought patterns that contribute to emotional distress and maladaptive behaviors, that we can control our thoughts. CBT has its origins in cognitive psychology and behaviorism. CBT therapists use techniques such as cognitive restructuring, changing negative thought patterns, behavioral experiments, testing beliefs through actions, exposure therapy, confronting fears in a controlled manner, and skills training to teach coping strategies. The goal of CBT is to help individuals develop more adaptive thought patterns and behaviors. By learning to challenge and change negative thoughts, individuals can alleviate emotional distress and improve their functioning. CBT is often more time-limited than psychodynamic therapy and can range from a few sessions to several months, depending on the specific issue being addressed. Psychodynamic therapy is rooted on the belief that it is the unconscious that shapes an individual's thoughts, emotions, and behaviors. The primary focus on psychodynamic is on exploring the unconscious mind and bringing hidden conflicts and motivations into conscious awareness. This is often done through free association, encouraging the patient to speak whatever comes to mind, dream analysis, and examining transference and resistance. The approach has its roots in Freudian psychoanalysis, but psychoanalysis has evolved over time to incorporate various theories and techniques. It typically involves long-term therapy with the goal of delving deep into the individual's past to uncover unconscious patterns and influences. It includes free association, expressing thoughts without censorship, dream analysis, interpreting the signifier and symbolism in dreams, and interpretation by the therapist to bring unconscious content to light. The goal of psychodynamic and psychoanalysis is to help the individuals to articulate the truth about their desires, being able to accept the repressed truth about themselves and to confront the elementary coordinates and deadlocks of their desires for subjective change to happen. Okay, so what does research say about the two theoretical orientations? In 2010, the independent Cochrane database of systematic reviews performed a meta-analysis of 23 randomized controlled trials, RCTs, covering more than 1,400 patients. Psychodynamic psychotherapy fared well in the short term. When measured 9 months later after treatment ended, improvement was even more notable still. This is significant because most of the research studies on evidence-based treatments access short-term protocols that typically last 8-10 weeks, and the outcome of efficacy of the treatment is measured only once, on the last day of study. One of the strongest studies to date is a meta-analysis that pitted psychodynamic treatment head-to-head against the prevailing favorites, namely CBT and medication. In 2017, Christian Steinert of the University of Gießen in Germany and colleagues conducted a meta-analysis of 23 randomized controlled trials, 21 of which compare psychodynamic therapy with CBT and 2 compare psychodynamic therapy with medication. Steinert wanted to use randomized controlled trials to make this study as acceptable to the evidence-based folks as possible. The patients who were studied had a variety of symptoms, including depression, anxiety, eating disorders, and addictions, making them as realistic group of subjects as possible. Most important, Steinert controlled for researcher allegiance bias by putting together a team that included those who align with CBT and those who align with psychodynamic therapy. Yes, researchers have their own preferences. It should be noted that researcher allegiance, which can easily lead to confirmation bias, is a significant problem within the field, and one of the concerning problems with the evidence base holding up the CBT orthodoxy. In fact, according to authors of a 2018 paper on the need for diversity in psychotherapy, researcher allegiance can have a major impact on results, and most CBT studies have a high risk of bias. Steinert's high-quality study unambiguously found that psychodynamic therapy is as effective as CBT and/or medication. Another study was done by Huber et al. From the University of Munich, comparing effectiveness of CBT therapy with psychoanalysis and psychodynamic therapy with depressed patients. Patients were compared at pre- and post-treatment and 3-year follow-up. What they concluded is that psychoanalytic therapy shows significantly longer-lasting effects compared to cognitive behavioral therapy, 3 years after termination of treatment. What is this telling us? That because CBT, like medication, focuses on symptoms, on the anxiety, on the depression, those are symptoms. It works well with, like medication, on helping the individual managing or tolerating the symptoms. But there is no subjective change. The individual manages the symptoms, but they never go away, and they can return with each trigger or challenge. Psychoanalysis and psychodynamic therapy, on the other hand, try to help the individual explore their true desires that are being repressed, avoided, not recognized by the individual. The symptom is a message of a conflicting repressed desire. The symptom is a signifier. It has a meaning that is being ignored by the individual. Numerous studies have shown that CBT and psychoanalytic psychodynamic treatments are equally as successful over the first few months of therapy. The problem, though, is that CBT results often don't last. The average time to relapse is 3-4 months, and overall relapse rates are as high as 71% by 1 year. So people see a therapist. In a few sessions they feel better because of suggestion. And later in time, they might feel the same way, seeing a therapist only when their symptoms are out of control. According to American psychologist Jonathan Shelder, whatever benefits short-term therapies provide, they are short-lived and don't endure. The majority of patients who receive CBT seek treatment again within 6 to 12 months for the same condition. To conclude, we must change the paradigm promoted mainly by insurance companies over simplifying mental health, making us believe that mental suffering has an easy and quick solution, that all we have to do is follow steps A, B, and C, and voila, all suffering will disappear. If that was true, all we have to do is follow the instructions in any self-help book. But reality is that each individual is unique, singular. Human beings are very complex. They are ambivalent, especially with interrelationships, and they think that they want one thing when actually they want the opposite, creating a conflict with their true desires. Perhaps then we can say that when the symptom is overwhelming, when it paralyzes and takes over the whole of the individual, that is when CBT is more effective. As it is difficult to reflect and associate when there is a crisis, that is when the therapist has to be more supportive and even conductive, directing the individual to overcome the harm inflicted on themselves. But once the symptom is no longer overwhelming, that is when what many call deep psychology is more effective. A therapy that wants to explore the unconscious meaning associated to that symptom for long-standing subjective change to happen. This takes time and patience. When a patient sees a therapist, they usually come with demands. One of those demands is, take my suffering away now. As therapists, it is our ethical obligation to let them know that unlike medicine, there is no magical drug that can do that we have to work together with patients. That is why I prefer using the word patient than client, because we all have to be patient, and a therapist is not really selling a product. If you liked this video and found it helpful, hit the like button and subscribe to my channel. Till next time.